Hey everybody, this is Renee. I am recording this in August 2024. It's been a few months since I did this interview with Mr. Ed Singer, and it originally aired on YouTube. It was an interview about the role of health officers in public health. I've taken the audio from that and edited it for the podcast, and here it is. The audio is a little flimsy. We did it over Zoom, and the connection, as often the case with Zoom, was not the best, but I did my best to clean it up a little. You'll hear a little bit of skipping here and there from the cleanup. I apologize for that, but it's a really interesting chat that I had with Mr. Ed Singer, who was the former health officer for Carroll County, Maryland, and he is talking about his trajectory from the military to being a health officer to now his new role, helping the people of Carroll County, Maryland with different needs. It's a really interesting chat. It's about half an hour, and it was a great privilege to talk with Mr. Ed Singer. So here is the audio recording of that interview. Hello, everybody. My name is René Najera. I am the Director of Public Health for the College of Physicians of Philadelphia, as well as the editor of the History of Vaccines project at the College of Physicians. I am here today on yet another public health chat here with Mr. Ed Singer. He is formerly the health officer of Carroll County, Maryland, and currently the manager of the local management board, providing services to families, youth, and children. And Ed and I know each other from one of our previous guests, my wife, René Najera. She's still working as a clinical consultant for the local health department in Carroll County, and worked with Ed at the beginning of the pandemic, which I hear some interesting stories came out of that. So Ed, thank you so much for joining us on this public health chat. I want to start off with the question of, in Maryland and in the counties in Maryland, what is a health officer?
It's an interesting question because I always like to say if you've seen one health department, you've seen one health department. And the health officers have very diverse backgrounds from physicians to I was an environmental health specialist starting my career. But generally, most of the health officers, some of them have an administrative background even. But from my perspective, a health officer is responsible for bringing together the services within the community, looking at health from the health of the community standpoint, where doctors generally treat patients, and our patient is the entire population of the jurisdiction where you're working. So you want to look at it, improving the overall health metrics for everybody within a county. And there's a lot of partnerships that go into doing that and trying to bring the resources together to improve the health of everybody in the community so that we all have better health outcomes.
And so what took you to that position within Carroll County? What was your trajectory on getting there?
So it's interesting. I had a degree in biology from Western Maryland College, which is now McDaniel here in Westminster. And I got involved in environmental health because it looked interesting. I quickly learned that environmental health wasn't really what I expected it to be when I first interviewed for the job. It was really how did we take care of environmental factors to keep people in the community healthier. If it came down to, well, a lot of people think of environmental health as being like an environmentalist. It's a little bit different than that because you're looking at it through a public health lens, and that how do we keep people healthy through environmental factors. And it may be that we have to do mitigation of certain types of environmental factors to take care of mosquito-borne illnesses or other type of vector-borne illnesses and things like that in the environment to be able to keep people healthy. Obviously, food safety and things of that nature were in environmental health, and water and wastewater, just all of those types of things. And when I first got my job, the health officer at the time in Carroll County was Dr. Janet Neslin. And we used to have long conversations about how the biggest advances in public health over the last century have certainly come in the environmental health area. We've made advances in vaccines and medicine and all that, but it's environmental health. The advances have been in leaps and bounds above what we've been able to do even in the medical community, just better treatment of water and wastewater and vector-borne illnesses and things of that, and all of this preventive type medicine that we did in environmental health. And so I didn't really necessarily envision myself being a health officer, but I was in the military, got a lot of leadership skills there. And as I moved up through the ranks in environmental health, I made a lot of connections in Carroll County, and really felt like when Larry Leach, who was our health officer at the time, left, that I could really bring something to the community because all of the people that I knew here and all the organizations I knew here, I felt like I had a talent for pulling people together. And it's interesting with the diverse backgrounds that health officers have. I think the most important thing that you can be as a people person, and that is be able to influence like the hospital, to work with nonprofits and law enforcement. And I was amazed when I became health officer just how many organizations we were really struggling with the opioid epidemic. And that was really one of the first things I dove into as a health officer, and just the number of organizations we were able to bring to the table and talk about issues that we could do to try to stop people from dying from opioid overdoses. The most important thing was to get everybody at the table. So we had a very odd variety. We had law enforcement, we had the state's attorney's office, the hospital, the local school system, a whole slew of nonprofits, a bunch of elected officials, things like the Boys and Girls Club, just bringing their perspective from youth, and so many organizations. There were 24 high level leaders that we had sitting in the table that we formed as a task force to try to figure out what the best things were we could do to deal with the opioid epidemic and overall substance use epidemic that we were experiencing in Carroll County. And that was, I think, as I look back on my career, I was health officer for almost 8 years, and I look back on my career, and I think the most important thing, and it set the groundwork for how we were able to successfully deal with the pandemic, was just those relationships that we had. And I knew people on a personal level, the hospital president and the superintendent of schools and the sheriff and the state's attorney. We went to a lot of events together, and we worked on common issues and relationships with our Department of Social Services and our county government and our elected officials. And it's the interesting thing with public health, at least from a county perspective in Maryland, is it's out there a little bit on its own, because it's funded from many different sources, and while it's kind of part of the state health department, it's also a branch of county government in some ways, and whatnot. And being able to build consensus, and a lot of times the state health department doesn't agree with what the local elected officials think and all that. And I found my primary job is just to find common ground on many issues, and figure out how we did the best thing for the community we could, while satisfying all the different organizations that we had some level of funding from, that wanted to have input and had some influence over policies that we were setting in local health.
Yeah, and for those who are not familiar with Carroll County, it's outside of Baltimore City, I guess is the biggest city closest to it. It's between Baltimore and Frederick, north of I-70, all the way up to the Pennsylvania line. So it's more rural, right? And then it has pockets of cities and towns, but I would classify it as more rural. But the proximity to Baltimore City, the proximity to Washington, D.C., and then up on the other side of the line with Pennsylvania, the proximity to York, et cetera, brings its own challenges for Carroll. I wanted to ask you, when the pandemic arrived, how did you feel? Like, what was your thinking? Here we go again with what happened in 2009 with that pandemic that thankfully was not too bad, or did you feel like it was going to be something else?
As it first arrived, I figured there was going to be a lot for us to do. A little bit, everybody's a little bit nervous. I spent time in the military. I spent 27 years in the Army Reserve. I had these concurrent careers, and I felt some of the leadership opportunities that I had in the military as an officer. Really, I'd been to Afghanistan and Iraq, and I'd seen a lot of things there and dealt with a lot of people and a lot of difficulties there and whatnot. And I'd also come up through public health. So I think my ability to, I felt confident in my ability to lead people. I just didn't know if we were going to have the resources that we needed to deal with the pandemic, and was concerned about the impact it was going to have on the community. And just seeing where things were going, I was confident that we had. The one thing I was really confident in, and it really did play out this way as the pandemic went along, was having those good relationships with elected officials and having those good relationships with all the organizations in Carroll County, even though it seemed like I was constantly fighting with the Department of Health for resources, and them not really understanding. It's interesting. I think a lot of times at larger organizations higher up, and I don't want to beat on the Department of Health too much, but I think they lose sight of what the boots on the ground actually do and what resources they need. And actually, during the pandemic, I found that the Department of Health was often trying to tell us what we were going to get, instead of letting us in an emergency response. And local health departments in Maryland all have an emergency response program, a FEP program, as we call it, Public Health Emergency Preparedness. And you work off of the principles of any emergency response. And when you're responding to an emergency, whether it's a public health emergency or whether it's a tornado or a flood or anything of that nature, the resources that you need, the response should be local. We should figure out what we need to do, and then we should ask for resources from higher up. Unfortunately, I think during the pandemic, often we were being told what we needed and what we were going to get and how we were going to do it. And that's a little bit backwards from how an emergency response works in any type of emergency, and made things a little bit difficult on us. But we managed to work through it because of all of our great local partnerships that we have here in the community.
You talked a little bit about your experience in the military and how that taught you leadership and skills to deal with these situations. Can you tell us a little more about how that helped you deal with personalities? Being in public health myself, I deal with some big egos and some differing points of view. All right. And so how did that prepare you to be able to, I guess, be the mediator of different strong personalities and points of view?
My job in the military was interesting because I went from being a commander of a engineer company where I had about 185 guys and a whole bunch of equipment and all that kind of stuff when I was a captain. And when I actually wound up deploying to Iraq and Afghanistan, I was on small civil affairs team where you essentially had three other Americans, 30 former mujahideen, a sack full of money, and they said, go out in the desert and live with the local people and do great things. I tell you, there was a lot that I just learned from being in the villages in Afghanistan, and it really gave me an understanding. We talk about trauma informed care and things like that, and in public health and whatnot. But just going to villages in Afghanistan and talking to the people about what was important to them. And I think one thing that I found is common of just about anybody in the world is we all want things to be better for our kids than our kids are important to us, and we want them to have a better life than we have, or at least as good a life as we had. We all want things to be better for our kids. And I was out in these villages, and it looked like the face of Mars, and there's no water, and they were in the middle of a 9-year drought where they had not gotten any rainfall, and they were struggling to survive. And just talking to people out there, it was odd because if you drove 3 hours north, and they didn't have cars or anything like that, so they'd have to walk. But I was just thinking in my head, I didn't say this to them, but thinking in my head is, if you guys just migrated out of here, you'd see something that was green, and you'd have things to eat, you'd have water and things of that nature. But in talking to them, I said, so why do you all live here? And I get the response, my father lived here, and his father lived here, and his father lived here, and this is our village, and it's Bubalay Kalai. And I just thought in my head, oh my God, this place is awful. And started thinking about it. And I was like, if I were born here in Bubalay Kalai, I wouldn't be any different than these folks are. And just trying to figure out how to work. You talked about working at a higher level, and I've worked with general officers and things like that. You've always got to try to negotiate something that's going to work for everybody and is going to please the commander and that type of thing. But I think I found it more rewarding just working with people on the village level as to what do you need? People who are willing to do things for themselves, try to give them a little help up, and what can we do to help make things better in your community? And really, it was a lot of the way I felt about public health back here. I was trying to help people make things better in Iraq and Afghanistan in some very tough conditions, and understanding that I was going home in 15, 18 months, and these people were stuck here forever. And if I was going to influence them to want to help us as Americans, I needed to find a way to help benefit them and make their lives better. And that has a common theme with what we're doing in public health a lot of times. So I guess
Yeah.
that's the leadership that I took from that opportunity, was that we work with actually tribal councils and different groups, just talking to them about what their needs were. And in public health, we do community health needs assessments to figure out what we can do to make the health of the community better, and that type of thing. So we were essentially doing similar type of assessments, but it was for everything out there. It might be infrastructure or agriculture or whatever. It wasn't just public health we were looking at. And we actually did build some structures and tried to build some capacity even from a public health standpoint when I was in the military. But it was interesting from going to having 185 guys to having this small team and wandering around. It was more responsibility, but it was a different kind of responsibility when I was deployed.
And you since left the health officer job at Carroll County, and you are now the manager of the local management board. Can you tell us a little bit about what work you're doing now?
So my involvement with the local management board was interesting. I'd worked for the local health department for 34, almost 35 years, and I just decided that it was time for me to do something that I liked more. And so I left the health department. I actually went into an environmental job for a couple of years and worked doing stormwater work and things of that nature. And just recently become the manager of the local management board in Carroll County. But there's all a connection here because I was talking about earlier the large group of people that we had together to deal with the opioid response, and a lot of this stuff in my mind it all relates together, and thinking about how we make things better for next generations and things like that. And what I saw as health officer, and one of the things that we did that I was most proud of was families were struggling. Either parents weren't willing to, or parents weren't able to be good parents to their children. And I really wanted those children to have the opportunity to grow up to be successful. And we were doing a lot of prevention work with substance use. And a lot of the conversations we had centered around what can we do to try to prevent young people from going down a path that their parents might have gone down and potentially falling victim to some of the things that people who suffer with substance abuse suffer with. And so we wound up putting out a request for proposals and talking with the superintendent of schools and everybody at the table. We all wound up agreeing that what we really needed to do was find a way to engage like the middle school age kids and try to provide them some support. So if they're not getting support at home and doing their homework or having positive role models or things like that, we put out a proposal for that. It was fortunate we had the Boys and Girls Club of Carroll County was already established here in Westminster, and they put in a proposal and took us up on it and started establishing programs, after school programs in all of our middle schools, and they essentially were taking college students from local college and bringing those folks in to be role models for these kids. They were closer in age. They were rather than looking at somebody my age or somebody who's older, somebody that's closer to their age that they could relate to, and giving them positive role models that could, and giving them leadership opportunities and positively engaging them so they want to be successful. And that was my health department piece of it. And when this opportunity opened up as the local management board manager, we do a variety of things. I actually oversee some of the funding that we provide for Boys and Girls Club here and some of the programs we do with them. So I love the Boys and Girls Club here. I also we've got a local clinic here called Access Carroll that was a
Mhm.
partnership between the hospital and the health department and its own nonprofit. And there's a lot of people that give time to it and whatnot. And it's just an amazing organization. We don't qualify for an FQHC out here, federally qualified health center, but we've got this thing that somehow we pulled together in Carroll County. And anybody who's seen this, how do we get one of those? It's the relationships that we had, and everybody decided we needed this, and everybody gave a little bit to make it happen. But here I am in this local management board position, and now I'm involved with Carroll County Youth Services Bureau and our Department of Social Services and our Department of Juvenile Justice and what we call our local management board, which is a bunch of folks who are appointed to the local management board. And it's our job to oversee the coordination of services to families, youth, and children, especially those youth that are what we would consider to be disconnected youth that are struggling, may have experienced homelessness, maybe having behavioral health issues. We've got a local care team that actually, if somebody's really struggling with behavioral issues or mental health issues or that type of thing, we pull together a whole team of people from all the nonprofits and the government agencies to try to figure out, give the family a roadmap of the services that are available to somebody so that we can try to make that child successful in their road to adulthood. And so they don't wind up either in jail or hospitalized or something of that nature, and try to help them with whatever the issues they may have, whether it's mental health issues or whether it's behavior issues or just needing some kind of positive influence in their life. We're working on all of those issues. So I'm passionate about this job because
Mhm.
I guess, like I said, everywhere I've been, I've noticed that everybody cares about what's most important is we want to see our kids have an opportunity to be successful. And I think as a society, in order for us to be a successful society, everybody has to have an opportunity, whether you're coming from some place where you don't have many resources, Afghanistan, or some people here in the United States that may have grown up in poverty or that type of thing. How do we help bring those people along? I mean, I feel very fortunate in my life that I've had opportunities that others didn't. I went to school on an ROTC scholarship, but and some people use the military as their leg up and whatnot. So it wasn't from an extremely privileged background, but I feel like I'm privileged more than most anybody else in most of the world. When you take a look around, all things considered, I've had a privileged life and I've had a lot of opportunities. So how do we give these other young people opportunities to become successful adults?
Hmm. Yeah, as a father, I get it. I see what people are willing to do for their children, the long distances traveled, the long hours worked. And I am, now that I have my daughter, I am very thankful for what my own parents did and everybody that helped, from random strangers to organizations who help get me to where I am. So let's go back to the pandemic. The pandemic hits, you have these relationships with other organizations that you have built over time, and you all need to come together for the pandemic. And how does that go?
Early on in the pandemic, obviously, we didn't have vaccines. I think a lot of the medical providers really didn't understand how to treat COVID, and we were really struggling with infection prevention and infection control, and also people were scared. And some of I'd have to say, probably the worst experience of my life, but really showed what the community could do was we had a nursing home where I don't remember the exact number, but we had about 110 residents there. And I think about 65 people died from COVID from the outbreak there. And you mentioned your wife, Deanna. She was great. We went down there and she made sure I was safe and we got suited up and that type of thing. And we went down and we knew we had a couple of cases there and we tried to go through and work on infection control practices with the facility. But I think by the time we had gotten there, it was probably already too late. I think probably one of the service workers there had been likely was the initial case and had spread it around to most of the residents, and everybody was already infected. The thing we really struggled with was people were upset because people were dying. And one thing I quickly learned about COVID was once you were infected, you didn't become uninfected. You either got over it, and you either got through it and you got better, or else if you were infected and you were severely compromised, and there are a lot of older folks in this nursing home
Mhm.
that they were eventually going to die even though they were alive. It progresses, and you really didn't see your wave of people dying until days later. And I don't know that there was anything that we could have done to uninfect those people at that point in time, but really was really said something we really struggled with. We had national press. It was one of the first big outbreaks anywhere in the country, and we had
Yeah.
national press all over the place, and they were trying to put cameras in windows and being very intrusive. And that's where the relationship with law enforcement became very important. They were able to do crowd control for us and that type of thing. And we got a mobile command center set up. And ultimately, we wound up actually getting we were the first ones to have the National Guard involved because
Yeah.
the medical provider at the facility wasn't willing to go and take care of the patients because he was scared. And that's what it essentially boiled down to. And we had to find doctors that I found a few doctors locally that were the National Guard got there first. And we also, I was working with our EMS, and I knew all of our folks from EMS just from dealing with the opioid crisis and everything, and collaboration we had done there, working with them on how we managed ambulances and who was getting transported and who wasn't getting transported. And I was actually on the phone with the president of the hospital one morning at 2 o'clock in the morning, and she had sent people to help at this nursing home. And she's like, well, they need these oxygen bottles or we're going to lose some patients by morning and this and that. And we didn't have necessarily all the resources. I knew I picked up the phone, called the fire captain. I knew he was working in Frederick County at the time. And I'm bringing you oxygen bottles. They're from Frederick County. It doesn't matter. You need them. And I've got them. And I'm driving them out there. And it was just, that relationship that the hospital was able to help us with some medical personnel. And then I knew the EMS guy, and he was able to help us with the oxygen. When the president of the hospital called me and said, hey, my person tells me we need this. And we ultimately wound up setting up a mobile command center out there. And We got a couple of docs involved in things to go down there and try to mitigate a difficult situation with that. But and that was the worst part of it. And having been in Iraq and Afghanistan, when you're talking about taking 35 body bags to a nursing home here in the US, it's just
Yeah.
something that I would have never thought that I would have seen in my life. And it was I think the saddest part of the whole thing with the pandemic was these older people were dying without being able to see their loved ones, and the people in the nursing homes were doing the best they could. But you got people who are gloved up in full protective gear and all, and that's the last people that some of these folks were seeing, and rightfully so. We had people in quarantine and isolation, and then as we progressed, back to these community partnerships, trying to get people vaccinated, I had all kinds of folks who were willing to chip in, and our local elected officials were trying to make sure we got the right messages out to people. There was a lot of disagreement everywhere in the country about what the right things were to be doing,
Mhm.
and what people agreed with or disagreed with. A lot of misinformation out there about vaccines, but I think largely because again those relationships with those elected officials, they were able to put out the right message, and we were consistent in our message that we were getting out there to our community. We had support of the county government, and many organizations were willing. We had a lot of providers step up and provide us help. And as I was looking at it, as we were getting into the vaccinations, this was our opportunity to try to get back to the point where we could be a little bit more normal. Because regardless, as before there was vaccines available, and this was spreading unmitigated through the population. Debates over whether kids should go to school, not go to school in person, that type of thing. I saw families that were personally impacted where a grandkid, there were a lot of grandparents who were caring for children, and grandkid would come home and give COVID to grandma or grandpa, and grandma or grandpa would die. And that's a heavy burden for
Yeah.
a child to live with. And it was just a lot of the precautions we were taking were to protect our most vulnerable people in society. And I think we were able to have those conversations here. That's not that there weren't disagreements in Carroll County, but I felt like I had the support of the people that I needed to, because again, these part goes back to these partnerships and relationships. And there's nothing I think more important for a health officer to be able to do than to have relationships with all the organizations that can impact public health. And whether it's an emergency response or whether it's day to day health department operations, those relationships are what's key to making a local health department and a local health officer successful in their work.
To close out, you talked about leadership, you talked about bridging gaps between people and reaching consensus and having those relationships for help and mutual aid. Just to close out, what are any, if any, characteristics additional to those that a health officer or somebody looking to be in a position of leadership within public health should possess or look to gain as they reach for that level of leadership?
The other piece that I've spoken to, Carroll Community College actually has a group of what they call STEM scholars that I've talked to
Mhm.
on a number of occasions. And one of the things that I've always found myself looking back on is just scientific principles and the scientific method and the things that I learned. When you're learning things in college, you're like, how is this going to apply in real life? And you don't necessarily see it at that point in time, but I'd say other than the leadership piece of it, being able to lean back on my science background and look at it from an analytical perspective, look at data, look at the facts, and then try to persuade people with the facts and the data and the scientific information. I think that's a very important piece of being a health officer. It's not that you have to necessarily be a medical doctor, and that's always great and helpful if you've got that whole background and you've been through that type of training. But I just think training in generally in a science background in general, in that way of thinking and that analytical thinking and using data to support what needs to be done and be able to explain those things to other people, is make those scientific arguments, is an important piece. And so that's the other piece from a public health perspective, and any part of public health and up to the position of health officer. I think that science background is an important piece to have.
Ed, thank you so much for joining us on this public health chat. I really appreciate your time. I thank you for all the work that you've done in public health, all the work that you've done in the military and everything else. I really do appreciate it. Having this relationship through my wife, having worked with you through the pandemic, I think brought me a great level of respect for you. And I really thank you for everything that you've done. If there is anything else that you want to add before we sign off.
Nope. I thank you for your time. I hope this was helpful. I hope somebody enjoys seeing it, and say hi to your. I haven't seen your wife in a while. Tell her I said hello, and enjoy raising your daughter. I think there's been no more joy I've gotten out of life than watching my kids grow up to be what I consider to be successful adults at this point. They're happy and they're doing their thing, and I'm sure. I hope you enjoy watching your daughter grow up as well. And it's neat when I think the thing I enjoyed most, and this just on a personal note, was watching my kids as they were trying to pick what they wanted to do in life and pick a college. And then my daughter, she changed her mind about 3 or 4 times, but that's okay. When you're young,
Yeah,
you can do that. And she thought she wanted to be in health policy, and she found out I like working with people. So I'm not going to work for Kaiser Family Foundation. I'm going to go get a master's degree in nursing and go out and work with patients. I think that's cool. It's so much fun watching kids grow up. So
it
it's a
is.
pleasure talking to you, Renee.
Again, Ed Singer, thank you so much for your time.